We are seeing more cases of obesity in our clinics. There are more kids that are coming in that are overweight, that are obese, and it's becoming more and more of a problem as they get older. But we also have kids that are starting off at 3, 4, 5 years old that are having severe problems with their weight.
We know that these children are starting to develop adult diseases. So it's not uncommon to have a very young teenager with type 2 diabetes.
At least half of the patients I see at Children's Hospital San Antonio fit that category. So it's just become way, way too common, and so common that people begin to think it's the norm. It's normal to be overweight and obese, and it's not.
One of the greatest concerns that we're hearing, both from families and communities and the medical community, is the rate of childhood obesity. What we see in our families is a very high level of stress, an economic challenge when they're shopping and they want something quick, and we know that quick and cheap translates into not necessarily a great nutritional value.
Nutrition science has gotten a bit of a backlash on is that it changes by the day. It really opens it up for anyone to have an opinion. So what is the reliable source? Who do we trust when it comes to nutrition messaging?
In 2013, out of concern for these alarming trends, Goldsberry Foundation partnered with the Children's Hospital of San Antonio to create a program that would encourage healthy eating among children and families. After 2 years of careful research and planning, culinary health education for families, Chef, was born.
Instead of reacting to diet-related chronic diseases, how can we think a few steps ahead and prevent it? How can we start with earlier generations, encouraging the consumption of healthier food options, encouraging the consumption of preparation meals at home, so that we can prevent these diet-related chronic diseases instead of reacting to them when it's probably too late.
The first of several chef teaching kitchens planned throughout the city is located at the Children's Hospital of San Antonio and available to patients, their families, physicians, hospital associates, and the general public. Rooted in the belief that food is medicine, the Chef program teaches children and families common sense nutrition and practical cooking skills.
One of the most interesting endeavors of Chef is this new approach to teaching nutrition that I don't think very many programs in the world are doing, and it's called culinary medicine. The wellness that comes from spending time in the kitchen and cooking wholesome meals, eating as a family. So the art of cooking with the science of nutrition.
They teach you from A to Z how to prepare the meal. You get to try it, taste it, and get excited about what you can accomplish in your own kitchen.
We want our patients to continue to get messages that really counteract this myth of diabetes. That's who we are. That's not who we are. We're better than that.
It's very helpful for us as moms, so you know how to eat and what to avoid, because sometimes you don't have the knowledge or the time to make those decisions by yourself.
You know, we want to give back to the community of San Antonio, and if we can do this to help change behavior, change lifestyle, make healthier foods more accessible, I think it becomes a recognized symbol of a healthier San Antonio, where there's a culture of health.
I think the Chef's program, along with a lot of other initiatives in San Antonio, is really trying to paint that picture of we can do something different and instilling hope of people taking on small changes that could lead to big differences in their lives, but most importantly, in the lives of their children.
How you eat, you're taught by your mom and dad. Chef, what we want to do is take the kid, the 6, 7, 8, 9-year-old kid, and say, I'm going to show you what good food is, and I want you to go home and tell mom and grandma and grandpa and your brothers and sisters, and if we can start that, we can start a chain reaction and let it permeate across San Antonio.